What causes high blood pressure? When the heart contracts and pumps blood via the arteries, the systolic pressure is measured. This is known as diastolic pressure, and it should be around 80 mm Hg in a healthy person. Blood pressure fluctuates throughout the day, rising in reaction to physical activity or stressful conditions, when the heart may pump more quickly. Blood pressure is also influenced by age, as the walls of blood vessels stiffen and lose flexibility as people age, resulting in increased systolic and diastolic blood pressure. Some of the risk factors for high blood pressure include: some people develop hypertension or high blood pressure without evident cause. This type of hypertension is known as essential hypertension. In people with this illness, the smaller arteries in the body narrow, requiring the heart to work harder to pump blood to distant organs and limbs. People with first-degree relatives who have the disease are more prone to develop hypertension. Hypertension can also be caused by medications. Hypertension is linked to increasing age. Hypertension is more common among people of African or Caribbean origin. A high dietary salt or caffeine intake, as well as a poor intake of fresh fruits and vegetables, all contribute to hypertension. Stress and having a type A personality are connected to high blood pressure.
Thank you for watching. Hope you will like the video I created for you. Please support me, click on subscribe. Then click on the bell. Please tap the below to view videos of the same series.